A lot of people come to me specifically to check their teeth and their gums for infections. And they're worried about losing their teeth. And that is important. When I die, I want to die with my own teeth. And I'm sure most or many of you feel the same way. But there's other reasons to want to get this treated. And when you think about it, your teeth are part of your body. And when you have an infection around your teeth, that infection isn't limited to just around your teeth. Did you know a large amount of your blood that's made in your body is made in your lower jawbone? So when you have an infection around your teeth, that infection is also getting into your bloodstream. And as it floats around in your bloodstream, different things happen. For example, we know that if you have gum disease, your risk of heart attack and stroke goes up. Some studies have shown that it goes up as high as 3 times greater than if you didn't have that gum infection. And what's happening is that infection is causing your blood vessels to swell. So it increases your total body inflammation. And by doing that, as your blood vessels swell up, the inside diameter, the inside lumen of those blood vessels gets smaller. If you have plaques and things like that inside those vessels, then they're closing up that lumen. That's what raises your risk of heart attack and stroke. And this has been interesting too. Inside the artery walls, in the middle thickness of those walls, plaques grow in those layers as well. And when you have gum disease, those plaques in the middle layers of your blood vessel walls tend to get foamy. And when they get foamy, that's when they tend to drop into the inside diameter of those blood vessels. That raises your risk not only of having a heart attack, it raises your risk of stroke as well. So gum disease can impact not just your teeth and your gums, but it's also can impact the rest of your health. If you've got a problem with blood pressure or you're taking blood pressure medications, that makes your mouth dry out. And so you have a higher risk of having gum disease as a result. But this actual gum disease can then impact the very thing you're taking those pills for. In Texas, there's a large percentage of patients that have diabetes. When you have active gum disease, it raises your blood glucose. Studies have shown that if we treat someone's periodontal disease, their blood glucose will tend to drop 10 to 20 milligrams per deciliter, which is really significant in a patient with diabetes. And so if you're taking all sorts of medications for your diabetes, or say that you're borderline diabetic, and you have gum disease, it may be that we can treat your gum disease and it will minimize your diabetes. Another concern with gum disease, and it affects the lungs. If you have a gum disease, you have a higher risk of lung infection, of sinus infections. In fact, the same bacteria that cause gum disease also cause sinus infections. In Houston, it seems like everyone has sinus problems of one sort or another. And the same bacteria that causes these chronic sinus infections causes your gum disease too. You have to manage it in both spots and actually to clear it. Another thing that impacts a lot of people is benign prostate enlargement. And gum disease plays a role with that too. So if you're an older male and you're having to go to the bathroom all the time and you have gum disease, it turns out that the inflammation from your gum disease can actually cause your prostate to grow faster. By treating your gum disease, it won't necessarily make your prostate get smaller, but it'll keep it from growing as fast.